Hey everyone, we are in the midst of a pandemic and Malaysia is starting its vaccination program. And recently there's a video that came out from a doctor, Dr. Roland Victor, who spread quite a lot of fear and vaccine hesitation. And I thought I would make a rebuttal to address some of the claims made by him in his video. Let's go.
Orang-orang frontliner akan jadi test bed ataupun mereka akanlah orang pertama akan jadi acid test. Dia akan kena acid test ni untuk tengok sama ada mereka sendiri nak ambil vaksin tu. So you guys yang duduk diam-diam tak nak komen apa-apa, nak kata padan muka tak nak lah.
So right off the bat, this Dr. Roland Victor is saying that the frontliners, the staff that are about to be vaccinated, they will be the acid test for other people, like I presume the politicians or even the rakyat jelata, the people, to see if the vaccine is safe and effective. Then only other people will take the vaccine. That's what it means by the acid test, right? The acid test, by definition, means a test that a thing goes through to prove that it is effective. Now, in this case, it doesn't really apply to the Pfizer-BioNTech vaccine. Okay, now I'm not being paid by Pfizer or any other big pharma companies to say this, but I'm just reading the research and the news reports. There's no need for an acid test. The Pfizer-BioNTech vaccine has already proven to be effective in lots and lots of major trials. It's proven to be effective and safe. We should take the vaccine. Again, this is classic misleading and misinformation. But let's go on.
Conditional registration for pharmaceutical product during disaster guideline. Disaster ni so kira macam dalam satu keadaan bencana, keluarkan apa-apa ubat yang mungkin boleh membantu untuk mengurangkan bencana tu.
Okay, he's saying here that Malaysia has gotten some sort of conditional emergency approval for the Pfizer-BioNTech vaccine. And just to clarify, even a country like Singapore, its own authorities have approved the Pfizer-BioNTech vaccine via a special pathway to justify using it during emergency. So, I don't see a problem with this.
So, apa yang menarik anak share is side effect. 1 daripada 10,000 orang boleh mengalami simptom paralisis muka ataupun cacat saraf muka dia, facial nerve dia, untuk seketika. Mungkin seminggu, 2 minggu, 3 bulan, 6 bulan dan sebagainya. So benda tu yang bila I tengok tu like, hey.
So it has been shown that the vaccines may not technically actually cause the Bell's palsy, which is the paralysis of the face that he has mentioned. In fact, sometimes the studies have shown that the incidence of Bell's palsy in the background is the same as with those people who took the vaccine. Meaning, these people would have gotten Bell's palsy anyway, even if they had not taken the vaccine. A simple point to summarize is this. Correlation is not causation. Okay, if two things seem related to each other, that does not mean that A causes B, right? For instance, let's just say that in the month of February there has been more rain. Okay, and in the month of February I have gained weight. That does not mean that rain causes Jason Leong to become fat. You understand? Correlation does not mean causation. So in this current climate, it has not been definitively proven or shown that vaccines cause Bell's palsy. In the very same way, no one has ever been able to prove that vaccines cause autism. So there is no need for this kind of fear-mongering and misinformation. Hey, what if you take the vaccine, you get Bell's palsy, you know? That's very irresponsible.
Maka akan adalah mungkin 50 atau kurang orang ada simptom yang macam mulut dia batuk, mata dia jatuh macam tu.
So which is preferable to you? 50 people getting Bell's palsy, which is not permanent, or let's say hundreds of people in the ICU, hundreds of people requiring ventilators, tens and thousands of people in quarantine, thousands of daily new cases, billions in businesses lost, hundreds of deaths. Which do you prefer, right? You see, when it comes to these kind of cases, when authorities approve vaccines, or approved drugs or medication of any kind is always on the balance of risk. When the benefits far outweigh the risk, then they are allowed to sell the drug, or in this case, sell the vaccine. It's always on a balance of risk. Risk will always be present, but that doesn't mean we should ignore a particular drug or a particular vaccine just because we are going to lose out on the potential major benefits those drugs and those vaccines may confer to us. So again, there's no need to spread this kind of fear and misinformation.
You get the virus kalau 2-3 hari sesama ataupun batuk, I rasa I lebih suka dapat virus tu 2-3 hari I batuk sesama daripada I nak suka-suka ambil.
12 minutes into his video, we have come into the most, I would say, blasphemous and the most irresponsible part of his video. Because you see, in the context of him being a person of authority, a doctor saying in front of the camera, broadcasted to, on social media, that he would rather have COVID than take the vaccine. I cannot think of a stronger word other than irresponsible. This guy is really irresponsible, okay? And it doesn't make sense, right? It's so ridiculous because you would rather face the potential complications of having COVID-19, which could be lung damage, you may not, you're in the hospital for prolonged periods of time, you may die, people may have to go into quarantine, do not see their loved ones for extended periods of time, businesses will close, you may harm your close contacts like your young children or elderly parents. You would rather go through this entire plethora of bullshit when it comes to getting COVID-19. You rather this than, say, taking the vaccine and possibly having some minor side effects like bruising in the arm. It boggles my mind that someone who is in the position, who has studied medicine, would rather go through the disease than prevent the disease. I thought one of the first tenets of medicine is that it's prevention is better than cure, right? So vaccine is one of the best ways to prevent something. So why not prevent something rather than going through the whole process of curing it? Would you rather have polio, tuberculosis, mumps, rubella instead of getting vaccinated against those diseases? Well, yes, your body may fight off polio on its own and you'll be fine. But on the other hand, you may be paralyzed in one leg or both legs or from your waist down, from your neck down. So on the balance of risk, this makes zero sense. And again, I have to emphasize that this part of the video, his video, is the most irresponsible, the most dangerous, and it needs to be shut down. Okay, Dr. Roland Victor, I do not know you. You seem like a nice guy, but for that statement alone, you should be ashamed of yourself.
I risau kepada orang-orang doktor-doktor yang kerja mereka sangat stres. Sebab bila mereka sangat stres, so stres mereka sangat-sangat tinggi. Okay, terbalik, kena lukis terbalik. Stres mereka tinggi, maka sistem immunity mereka akan rendah.
Now this part checks out, right? When a person has more stress, their immune system is depressed. So same like all the frontliners, they are all now very stressed because they have a lot of patients, new waves of patients coming in. They have to be in PPE under the hot sun for many hours a day. They're very stressed. They're afraid of for their own lives. And you know what can relieve their stress? If people start taking the vaccines. You understand not?
Tapi kepada you guys yang luar sana yang kerja KKM and everything, sebab you guys sangat pendiam, tak lantang langsung nak komen pasal benda ni.
Now surprisingly, Dr. Roland Victor makes a very good point here about the people who work in KKM. Now I've been in KKM for quite some time, and I know now we are all quite impressed with KKM because we get really good healthcare, really good universal healthcare, especially in this time of pandemic. KKM is doing all it can to fight this pandemic. But I know for a fact that a lot of doctors, a lot of nurses, a lot of healthcare professionals in KKM, they don't dare to voice out for whatever repercussions they may face. I have lots of friends in KKM. I know how they feel. I know that they're always very reluctant to voice out their opinions. And Dr. Roland Victor is right. Sometimes we as healthcare professionals in KKM should learn to voice out. Unfortunately, I understand this is Malaysia, the climate is different. So I want to point out that in this whole video where there's a lot of misinformation, along the way, Dr. Roland Victor makes some good points. And I agree with him, sometimes semua penjawat awam di KKM perlulah lebih lantang bersuara. Bila kita bersuara ni, inilah kebaikan untuk semua orang, untuk KKM, untuk rakyat. So please, those of you in KKM, I understand your fears, but I hope you voice out more frequently and more loudly.
Bukan I kata vaksin tu tak bagus. Mungkin vaksin tu berkesan, tapi
no, vaksin tu berkesan.
We need more time. We need more time to see what is the effect and everything.
We have dedicated enough time to make sure that the vaccines are safe and efficacious. And I'll make an inelegant argument, okay? A rather crude argument, but it serves to make the point anyway. If the vaccine is good enough for the President of the United States, the Queen of freaking England, the Prime Minister of Singapore, a very cautious and safe country, if their top guy thinks it's safe enough for himself, I think we are okay.
Tapi kalau orang kata ke sana, we will give the politician first, I sokong, biar mereka dapat dulu.
No, I don't sokong this idea. Why should politicians in their cushy, comfortable jobs with their income secured for God knows how many years, why should they be the first to get vaccinated? Shouldn't we vaccinate the frontliners, of course, and the people who are at risk, people who cannot work properly if they don't get vaccinated, right? I believe it's always rakyat first, not politicians first. So when I know that something as effective as this kind of vaccines, why should good things be given to our ministers and all the politicians? They work for us, like we are the boss. So the boss, us, should get the vaccine first, and the workers can wait in line, right? Why should they be so privileged to get the vaccine first?
I'm not ready to take the Pfizer vaccine yet. Macam I lebih suka tengok kepada vaksin yang Russian develop.
So let's compare the side effects profile of the Russian vaccine, okay? According to a news report, there were 7,966 total events out of 21,977 patients injected with the vaccine. 7,966. This encompasses everything from really adverse reactions to minor complications. So 7,966 out of 22,000. That is not a major, massive leap in safety profile than the Pfizer-BioNTech vaccine. Again, I know I sound like a shield for Pfizer, but I'm telling you, I'm not being paid by them. I'm just saying, I'm just reading the facts, reading the news. It's not as if the Russian vaccine is a lot more safe than other vaccines. Also, it's been documented that the Pfizer vaccine is 95, 94, 96% effective versus the Russian vaccine, which is 1 or 2 percentage points lower. So again, this doesn't compute, doesn't make sense.
And I think yang paling I suka sekarang ni yang is the Indian vaccine.
Okay, the people in India have done a great job. Let's look at the side effect profile. Okay, according to a news report, there were 447 adverse reactions. These are the more severe reactions. Okay, 447 severe adverse reactions to the COVID-19 vaccine in 224,301 cases. So again, this falls under a similar, not to say the same, but not altogether different safety profile than other vaccines. So again, I don't see why a person of your caliber would choose one particular vaccine over the other and are so afraid of one other particular vaccine. Again, it reeks of irrationality. And again, to put that all in the video when we are about to receive the first dosages of the vaccine for our frontliners, it just reeks of irresponsibility.
So, memang mutant lah. Virus ni memang mutant. Virus ni memang viral. Sebab tu, kalau you beli antivirus pun untuk komputer, mana boleh sekali you beli antivirus tu sampai 20 tahun, 30 tahun you guna. Sebab orang-orang yang buat antivirus tu lah yang mungkin buat virus-virus macam ni juga.
So he's saying that when we buy an antivirus software, we have to update our virus database in our computer so that we can combat the latest viruses. So it's like if you want to continuously update the virus database in your own body, you have to install like a kind of antivirus, like, right? A kind of antivirus software. If only there was a way, there's a drug that we can take to build our immune system so that we don't get these viral infections. Oh wait, I think we do.
Sebelum darurat diisytiharkan, saya nak bagi tahu, masa tu mereka dah kata 171 orang dalam ICU and 76 orang memerlukan ventilator. So, bila situasi tu, kita dah kata kepada Sri Paduka Baginda that sistem kesihatan kita akan lumpuh. Tapi 6 Februari semalam, selepas PKP 3 minggu 4 minggu, kes ICU 305, kes gunakan ventilator semalam 139. Maka ada lebih 60 ventilator datang entah ke dari mana.
Ventilator itu datang because we asked for it loh. We sourced for it loh. Right? It's not like there's only 10 ventilators in Malaysia and then we are doomed. We have a lot of ventilators. We just, corral them, put them together and dedicate those ventilators for COVID-19 patients. It makes sense, right?
ICU ada lebih 130 bilik ICU datang daripada langit. Kita tak tahu macam mana. So,
again, what on earth are you talking about? Malaysia's healthcare system, we have a lot of ICU beds. It's just that now we have to dedicate more of those ICU beds to COVID-19 patients. And this has a hidden cost. The hidden cost is other people who need ICU beds, people who don't have COVID-19 but they require ICU beds anyway, now they don't have an ICU bed. Therefore, other people suffer, just that this hidden suffering which we do not see immediately. Let's take for example a case where you need to go for a big operation. Okay, now this operation may not be an emergency operation. Surgeons may have planned it weeks in advance, but because the operation is so major, part of the post-op recovery plan requires the patient to rest in the ICU, because in the ICU they have more nurses, more resources dedicated to one patient to ensure that this patient recovers fully from the major operation. Things like Whipple's procedure or a big heart transplant or a CABG where they replace the damaged arteries in your heart. These are major surgeries which require backup ICU beds. But now, because we have decanted those ICU beds for COVID-19, these people's elective major surgeries will have to be delayed because the bed is taken up by COVID-19 patients. So you see, there is a cost to all this. That's why we had to flatten the curve in the very beginning so that our healthcare system does not get overwhelmed by a sudden influx of COVID-19 patients.
Macam mana kita nak katakan tu that masa at the number 171, 10 January, you said the healthcare system collapsed. Today, in ICU, 305 people are in. And ventilators move from 76, 76, naik kepada 136. How come sekarang kita punya sistem nampak okay?
This is, in my opinion, the second most irresponsible part of Dr. Roland's video. Kita punya system nampak okay. Our healthcare system looks okay. I agree. It looks okay. Now, I've been out of the service for like 7 years, 6 years. But even then, I know that the healthcare system is buckling under pressure. I have friends who are frontliners and they tell me of horror cases where they have to sleep on the floors in alleyways because there's no place for them to rest. They are working their minds off. They are constantly stressed. Some of them have to get their own supplies, their own PPEs, whatever. No one in the public service sector, the public healthcare service sector that I know of seems okay. None of them are saying everything is fine, everything is perfect. No. The healthcare system is under a lot of pressure. And one of the best ways to alleviate this pressure is to get the population vaccinated so that it does not burden our healthcare system. So, once again, I feel that someone in your position, in your profession, should have released a more informative video to educate the public and to encourage the public to take the vaccines when it's available.
Kita buka lagi banyak jalan, kita buka lagi banyak business and everything. So mathematically saying, you lied to us.
I'm not going to talk about whether or not we need a darurat or emergency to combat COVID-19. Okay, that's a whole different video altogether. But to defend KKM a little bit, I can kind of understand why someone like the DG of Health would say to people that our healthcare system will be paralyzed if we don't do something drastically now, right? Let's say, for example, you have 100,000 ringgit in your savings, okay? And you need about 5,000 ringgit a month to survive, right? Not even savings, just 5,000 ringgit to live. One day you lose your job and you go through 1 year with zero income. Now, the savings in your bank is down to 40,000. You have spent 60,000 to live, now you have 40,000 left. You're not bankrupt, you're not starving, you have a roof over your head, but aren't you panicked? Won't you be worried that if this continues, your resources will be fully drained and you're homeless and you're bankrupt? Of course. So I can understand the point of view of the DG to say, look, we are about to experience a healthcare emergency, a healthcare crisis. We need to do something drastic. Something drastic like get the goddamn vaccines. The vaccinations will prevent us from continuing down this slippery slope. And again, these kind of videos where you try and make people vaccine hesitant, this does not help the global and our national cause.
Data yang you sendiri buat, you tak boleh cover.
There is no proof that KKM has fudged the COVID-19 data.
Yang itu yang I rasa sedih lah. And kalau nak katakan PKP tu perlu, kita kena ambil kepada satu situation di Sabah, di mana kes di Sabah sangat tinggi. And bagi semua orang kat luar sana, Sabah hanya ada 3 hospital yang besar. Macam mana kat sana kes dah semakin hari semakin menurun, and you tell me that they could do it there, and dekat KL kita tak boleh handle.
Because KL and Sabah are not the same.
Singapura pun immunity, they all dah buka seperti biasa. Dia makan 8 orang satu meja.
You know what else has Singapore been doing? They have been vaccinating their people. Understand? Huh? Here are my final thoughts on this whole incident. Okay, now I don't want this video to come across as a personal attack against Dr. Roland Victor. Okay, and I personally feel that a police report by the KKM on him is excessive. There is no need for these kinds of punitive actions, right? By all means, MMC or MMA can haul him up for a disciplinary meeting or something like that, some form of professional punishment, right? But I don't think hauling him to the Balai Police for a statement is productive, right? And I don't want my video to come across as a personal attack, because on all accounts, I think Dr. Roland Victor is well educated, he's smart, he genuinely cares for people, he cares for his patients and his business. I can understand that. He may be a little bit, how shall we say, misguided in his video, trying to show that, or trying to instill some form of hesitancy or fear into people with regards to the vaccine, especially at this crucial point when today, as of recording this video today, we have received our very first shipments of the COVID-19 vaccine. So it's not that he's stupid, okay? And therein lies the problem, okay? And this is my own anecdotal experience. When we think of people who are anti-vaxxers or vaccine cautious or vaccine hesitant people, we think of them as some fringe lunatics out on the sides, right? But actually, there are a lot of people who are well educated, they are smart, they kind of know how to push the buttons of people, they know how to instill that fear, and these people exist, okay? And this is the scarier problem, because I personally know, not just Dr. Roland Victor, I personally know other doctors currently in service, currently seeing patients, who they themselves, if given a chance, would not take the vaccine. And it's not because they watched this video. No, it's through, I don't know what, they have developed this hesitancy and, how shall we say, irresponsible cautiousness or wariness towards vaccines, which is bad because if you think about it, if people within the medical fraternity are already vaccine cautious, not all, just a few, but even if in people who you think are going to be 100% pro-vaccine, even among this group of people, there are a few who are anti-vaxxers or vaccine cautious. That must mean that a significant minority in Malaysia won't take the vaccine. And that's the problem, you see, because for this to work, it must be all of us. If it's not all of us, it's going to be none of us. If all of us are not protected, none of us will be protected. That's the point. And when it comes to vaccine, right, people think of vaccine as a personal gain. Like, I take the vaccine so that I don't get COVID-19. But that's a wrong way to look at it. Vaccines help everyone, right? And there are people right now who cannot take the vaccine. You must understand, there are people who are immunocompromised, they are cancer patients, they are on steroids, children who have cancer, people who have HIV, AIDS, some rheumatoid conditions where the immune system is depressed. These people, not only are they more susceptible to infections, they themselves cannot take the vaccine. Therefore, for herd immunity to be conferred on the whole of Malaysia, people who are healthy and well must take the vaccine to confer the advantages of herd immunity on people who don't have the opportunity to take the vaccine. Okay? So in a nutshell, vaccination is not just for your personal gain, it is your societal, civic, and national duty to take the vaccine so that you can help those who can't take the vaccine. Okay? So I applaud all the authorities' work in ensuring that everyone gets the vaccine. I hope we all do. And if there's one takeaway from this video, is that please take the vaccine when it's available. Don't be distracted by the noise, stick to the facts, and take the vaccine. And I'll see you on the other side. Bye-bye.